What's going on, guys? Tony Maritato here. In this video, I want to talk to you about the 5 most exciting opportunities facing you as a physical therapist in 2001. Now, these aren't all new opportunities. These opportunities have been around forever, but I want to reiterate, this has been the most exciting, from a business perspective, the most exciting 12 months I've ever seen. Starting in March last year, the opportunities to grow and develop services and businesses that nobody has ever done, ever, in the history of physical therapy is just incredible. And the opportunity for you to start building independence, resilience, your autonomy right now is more exciting than it's ever been. So seriously, let's talk about the 5 opportunities. Number 1. Consider mobile services. Consider becoming a Part B Medicare provider, treating Medicare beneficiaries in the home, or whatever your patient demographic is, whether it's pediatric, geriatric, in between. There are huge opportunities right now because patients still do not want to go into busy clinics. While yes, I own and operate 2 outpatient physical therapy clinics, on a daily basis, we receive new patient referrals and new patients coming in the door that are saying, I didn't want to come because I didn't want to be around a bunch of people. Now, we're keeping our schedule light, we're spacing appointments out, we're doing everything we can, but the idea is this is still in the patient's mind. They do not want to be in busy clinics, and they're thinking back to the last time they went to physical therapy somewhere else, where one therapist had 5 patients all huddled around each other within 10 feet. So look at mobile therapy offerings, look at becoming a Medicare provider. It is just incredible how quick and easy the process is right now. Everything is expedited. Exciting opportunity number 2. Obviously, we couldn't have a list like this without talking about telehealth. Telehealth has opened up so many doors, and I want you to understand it's not just patient care. Telehealth could be synchronous, but it can be asynchronous. I regularly have clients local to the Ohio area send me questions, send me emails, record video asking me questions. And then when I have the time and the opportunity, I record a response to those questions and send it for a fee. That's an asynchronous telehealth opportunity. Of course, synchronous, it's not just about patient care. You could be there to answer questions. You could deliver peace of mind. There are so many education. Education is a huge opportunity in telehealth. Educating the patient, educating the family, the caregiver, talking to other providers. So telehealth, without a doubt, self-pay, covered service, huge opportunity in 2021. Developing a hybrid practice model. You know, I'm a huge fan. We've all known about the value of wellness since we've been licensed. But developing the model in which you deliver covered services combined with non-covered services within a single session. It used to be back in the mid-90s, you would discharge your patient and then you would offer them a wellness package, personal training, things like that. You would never even consider offering them self-pay services while they were on a covered plan of care. But now, routinely, we're able to provide therapeutic exercise, therapeutic activity, neuro-re-ed, while they're receiving covered services, those being the covered services, and in conjunction, offer some of the stuff that's beneficial that they might like, but might not be medically necessary. A little soft tissue massage that's not medically necessary definitely goes a long way to improve the patient care experience. It can be sold as a self-pay standalone service. It's not medically necessary in all cases, but patients are more than happy to pay for it. So consider developing a hybrid model in which you're delivering covered services paid for by insurance, and alongside that, self-pay services that are not medically necessary but are beneficial to the patient and that the patient is willing to pay for. Number 4, we've got digital products. We cannot live in 2021 without having digital products. A digital product could be a home exercise program membership that you sell on a monthly fee or a one-time purchase. A digital product could be an educational program. If you're in youth sports, you can provide an education program for the parents to say, look, here are the 5 signs of an athlete with ACL deficiency or insufficiency or whatever it might be called. You could develop a program that teaches caregivers, STNAs, CNAs who are in the home with geriatrics, a program that teaches them how to help those individuals after a fall, a non-emergency fall, how to help their clients transfer on and off the commode. Any of these things, there are so many opportunities in the digital product space. It doesn't all have to be patient care related. You could be educating the caregiver, you could be educating the adult children. There's just tons of opportunities, and people are more than willing to pay a single absolute fee, $20, $50, $100 to get a digital product than to enter into an agreement with a therapist that they don't know how long the plan of care is going to be, they don't know what insurance is going to pay, what it's not going to pay, what their responsibility is going to be. That stuff gets messy. But if you're selling a digital product that's got a price and it's got an exact description of what it provides, people will snap that up. It just has to bring value to the client. And then number five, build your personal brand. You know, it's just unreasonable how easy it is these days across social media platforms. I'm not on all the platforms. I don't do anything on Instagram. I don't do anything on TikTok. I should be on LinkedIn. I'm not. Like, I pick 2. I'm on Facebook and I'm on YouTube. That is where I spend my time. That's where I do my best work, and that's where you found me. And so I dedicate time every single day to building my personal brand, to helping deliver value to the people who are searching for it, the people who have raised their hand and said, I need an answer to a question, right? Real brief, there's a difference between push versus pull marketing. It's a term coined by Seth Godin. If you don't know Seth, go search him. He's amazing. But we want, in the healthcare world, in PTOTSOP, we want to focus on pull. We don't want to shout at people. We don't want to tell people how amazing we are. We don't want to tell people about all the value we offer and all that stuff. We don't want to convince clients to hire us. That's not why we got into healthcare. We want them to already be convinced. We want them to be seeking us out. We want the individual that's so desperate to work with you personally because they've seen you, they know you, they like you, they trust you, they've watched you on Instagram or on YouTube or on Facebook or wherever, and they know you have the information they need. And so they're willing to pay any price. They don't care if insurance covers it or not. They need the solution that you have above your shoulders, between your ears, and so they are willing to pay for it. That is the ideal client. But we can't expect them to just automatically know who we are and what we do. We have to build our personal brand. We have to have our website. We have to have our social. We have to have content, pump out content every single day, because everybody is not going to see every post. And if they're sick of you, they'll just stop watching. They'll turn off their notifications. They'll unlike your channel. Who cares? They are not your ideal client. They're not going to be the ones hiring you. Where 10 years ago, 15 years ago, if a new therapist came to me and said, Tony, I want to start a business, what should I name it? The last thing in the world I would tell them to do is brand themselves, because you want to brand the company, you want patients going to the company. Totally different environment today. 10 years makes a world of difference. Today, it's all about you. You look at my branding, you look at my information, everything is focused on me, even though I'm not the one treating patients. But it's my team, it's my culture, I put it together. That's what people are searching. They want to find an individual. They don't want to find a company. So please, if you did nothing else, build your personal brand. It will pay you tenfold the return on your investment, and it will open up opportunities for you to do just about anything you want in the profession. So guys, I hope this information was helpful. If it is, please give the video a thumbs up. Let me know in the comments if you have further questions, if you want other ideas. We're just pushing forward. And if you want to join us, obviously, find me on Facebook, watch me on YouTube, and I wish you the best. I'll catch you guys on the next video.